Shame is a soul-eating emotion. That's a quote by Carl Jung. And if he's correct, then shame is an act of aggression against our innermost selfhood. In shame, we act out scripts of self-destruction given to us by others who witness this, plant those seeds within us, and then do nothing. I want to talk to you about a complex population that is handed shame scripts from 3 different sources. I'm speaking about gay men who were abused, sexually abused as children, who are experiencing homophobia in their lives, and who are also in the throes of substance abuse, where they also receive stigma. Before I get into those clinical issues, I want to talk to you a little bit about gay culture and gay community. First thing to know is that gay culture and community is born out of oppression and discrimination. Here we have our very starts of gay rights movement at Stonewall, and then more modern movements of fighting against oppression. Also, we need to know that the gay population is a dispersed population. It's not a culture of place, it's a culture of identity or a culture of experience. Another thing to note is that within that culture, within those communities, there are strengths as well as risks. The other thing, and finally, is that the culture evolves, and so too is the gay culture and gay community. As oppression and discrimination lessen in the greater community, there are changes that are happening within the gay culture and community. And some even say that eventually there won't be a quote-unquote gay community anymore because it will have been absorbed into the mainstream community. So now let's start to talk about trauma. Every gay man or woman experiences homophobia. External homophobia and internal homophobia. Basically, homophobia is prejudice against homosexuality and LGBT people in particular, and heterosexism is the institutionalized forms of homophobia that you might see from governments or schools or institutions like churches. These messages get inside of a person as they're growing up and become internalized into a sense of shame about oneself and about one's feelings. And really, all gay men are going to experience this at some point to some extent within their lives. Here's some research on gay men and trauma, and what it shows is that gay men are overrepresented in samples showing that they have been abused as children or have been harassed as adults. There are theories about why this might be. One, the vulnerability theory talks about how gay boys, as they're growing up, might be isolated from their parents because of the secret they hold, and they might be vulnerable to predators seeking them out that are looking for children who are isolated or needing someone to talk to or feeling bad about themselves. And then the nonconformity theory, there actually is some evidence that when children show gender nonconformity, even in young ages and teen years, that they are at risk for abuse, neglect, and from their parents and harassment from their peers. Now let's look at gay men and addiction. Again, in clinical and non-clinical samples, gay men are overrepresented in samples of showing higher rates of substance abuse than heterosexual men. And here's some of that research. Now, why would that be? Well, again, there are conflicting ideas about this, but one is that indeed living a life in a world where you're oppressed and you're told you're not good enough or you're sinful or perverted might lead you to seek out the solace of substance use. The other thing to think about is that gay culture, modern gay culture, really grew up in bars, and in those bars where people socialized, there was of course drinking and drugging, and so for certain generations of gay men, that might have been the way they entered into the gay community and sort of become a habit of them dealing with their homophobia. This is an interesting graphic from Finnegan and McNally in 1987, and it shows that there's a dual stigma, that for gay men who are addicts, they're really ostracized because of their status as being homosexual, but also as being an addict. So they get sort of a double jeopardy. And here's what I call the nexus of shame. When a boy grows up in a homophobic environment and identifies as gay, begins to use drugs in adolescence, experiences trauma in his early life, sexual trauma or physical trauma or neglect or abuse, that sort of thing, all this combines into a nexus of shame because he gets shame from all these different sources. So what is shame? Shame is a negation of self, okay? It's universally expressed as sort of downward cast visage, covering the face. We see this across all cultures. Some cultures, Asian cultures, even talk about losing face as their description of shame. Okay, so this is from Rick and Sensi, and he talks about a cycle of shame. And he says that it begins with, being basically abused, and getting negative messages in your family of growing up gay in a dysfunctional family where there's abuse and neglect. So you internalize those feelings, you suppress your own feelings, you develop a false self, you start having deviant behavior, perhaps drug taking or that sort of thing, alcohol abuse, and you end up with lowered self-esteem and, again, shame. So what does shame do for us? We withdraw into our own world, into a cloud of shame. And these are the kinds of feelings we have: isolation, we silence our voice, sometimes self-harm can erupt, and certainly, as we've seen, substance abuse is quite common as well. So here's the cycle of addiction and shame. Basically, shame is thought to be a partial cause of addiction, perhaps not cause, but associated in the sense that it causes people to seek out substances for comfort and solace. But also, once you are addicted, because that is looked at as stigmatized in our culture, then you have shame from that as well. So it perpetuates itself as a cycle. So what do? Self-compassion is an intervention, which some say is the antidote to shame. Self-compassion was worked on conceptually and through research by Kristen Neff and Christopher Germer. In about 2003 was when the first article came out. And it's described as compassion turned inward. There are three phases of self-compassion: self-kindness, mindfulness, and common humanity. Self-kindness is feelings of warmth and compassion toward yourself, especially when we fail or have some problem in our life or some trauma in our life. We approach ourselves with self-kindness, compassion. Mindfulness is being mindful of our frailties, mindful of our problems, mindful of any crisis in our life, but not trying to push it away or pull it toward us, but just being mindful of it. And common humanity is realizing that we're connected to all other people in the world, and everybody has problems, everybody fails sometimes, everybody has pain, and so there's really no reason to single ourselves out or feel alone in that process, but rather feel connected to others as we all have that same experience of having frailty and pain. Self-compassion and shame are looked at through the research. There's been a lot of correlation research on self-compassion, and basically what we've found is that self-compassion is positively associated with a lot of positive psychological growth factors: curiosity, wisdom, emotional intelligence, forgiveness, and it's negatively associated with these negative psychological factors: anxiety, depression, perfectionism, shame also. So that's what it looks like from the correlation research. And actually looking at self-compassion and addiction, there's been a handful of correlation studies, and here they are. And they have shown basically that self-compassion is negatively associated with substance abuse symptoms, especially craving and rumination. Here's what a self-compassion training would look like. It's 8 sessions, 8 weeks long with a retreat in the middle, but in actuality, a lot of the researchers are using shorter form exposures, which have shown to be effective. So that's really something that we need to think about in terms of the full training or a smaller dose. So here's what I'm suggesting. There's research that shows that the phases of mindfulness are actually negatively associated with aspects of shame. For instance, self-kindness is negatively associated with the sort of self-loathing and that kind of negative feelings that one gets in shame. And mindfulness is negatively associated with sort of catastrophizing and thinking that because there's something wrong with you, nothing is ever going to go right. And the common humanity is negatively associated with those feelings of being the only one, feeling isolated, out of touch with the world. And this is from research from Moswich. So perhaps self-compassion then is almost like a healing nexus to contradict or deal with that nexus of trauma and shame. I think we should talk about precautions and adaptations. Not everybody likes the idea of meditation. Some might think that it's too religious or too esoteric. Also, anytime we ask people to meditate, they could encounter negative thoughts or images or experiences or memories. So I think we should warn clients about that and tell them what they need to do and how to guide them with that. So in conclusion, we really do need more research in this area, especially randomized controlled trials and longitudinal studies. Self-compassion is an emerging intervention, and we need to be careful about that, but I think it does show promise, and it has shown to be safe. No one has reported any side effects or negative events from the work, but I think it's an auxiliary intervention, and it would mesh nicely with CBT interventions or motivational interviewing or ACT. However, the therapist should also practice self-compassion meditation as well so they really understand the process from the inside. The last thing I want to really say is that one of the things I talk about with my substance abusing clients who are early in recovery is that the crucial question for them at that stage in early recovery is whether they are worth saving. And this gets right to the heart of self-compassion. Are you worth saving? If someone has shame, then they're not going to be able to answer that question yes, or at the very best they're going to say, I don't know. What our role is to help carry them through that, on the other side of that, where through self-compassion, they come to the unequivocal, yes, I am worth saving. Thank you.